Hi, I'm Dr. Michael Scheiber from the Institute for Reproductive Health, and I'd like to speak to you a little bit about choosing an egg donor today. Many of our couples, the primary question on their mind once they decide to make that jump to egg donation is how to choose a donor. Here at the Institute for Reproductive Health, we have a continuous screening program, so we're constantly recruiting new donors from a pool of volunteer women. And the first thing I like to tell couples is you're going to know more about your egg donor than you know about each other. And that's because of the very extensive screening process that our egg donors go through. Even more screening than typically you'll get going through a cycle using IVF, using your own eggs or sperm. So our egg donors are screened very carefully, and our potential recipient couples get all of this information available to them. You get 4 generations of family history, what they do for work, how far they got in school, what their grades were like, if they have children of their own. They all have to pass the PAI or the MMPI, which is a personality inventory screening test. They get screened by the psychologist or psychiatrist in our practice. They undergo genetic testing, infectious disease testing, medical testing, and as a recipient couple, you get all of that information available to you before making your choice. So the testing is very, very thorough and very extensive. And for most couples, that really, helps them come to a good conclusion for a donor that they'd be really happy with. Like most donation programs, whether that's kidneys or lungs or hearts, egg donation has more recipients out there than donors at this point in time. So there is a small wait involved. Most of our patients are somewhere between about 4 and 6 months on the matching list before we get an appropriate match that they're going to be more than happy to work with. In terms of being an egg recipient or an egg donor recipient, it's actually much easier for a woman to be a recipient than it is to go through an IVF cycle using her own eggs. And the reason is that the donor's doing a lot of the hard work with the fertility shots and the medications and the treatments and the egg retrieval process. Somebody's doing all that work for you, which makes it fantastic. So in terms of doing an egg donation cycle, we do have to get the recipient uterus and the egg donor lined up. So we have some medications we use typically for 2 to 3 weeks before the cycle in order to help line up your cycles. Following that time, most of our recipient women will start on oral estrogen therapy, starting to thicken the uterus to be prepared to receive the embryos. Meanwhile, the egg donor will be going through the fertility injections and the ultrasound monitoring the blood work and everything to determine when the eggs are mature. When the eggs are mature, the egg donor goes through the egg retrieval process to gather the eggs, and that day we need the patient's husband here to come in and give us a sperm sample so that we can fertilize the eggs. And then anywhere between 2 days and 6 days later, usually on day 3 or day 5, we select the 2 best embryos to place back into the uterus of the intended parent. And that woman would be on, in addition to the estrogen therapy, at that time progesterone therapy to continue to support the pregnancy until 2 weeks later we hopefully get some good news on your pregnancy test. So that's what's involved. If you have any questions about that, any member of our staff would be happy to talk to you more about selecting an egg donor and what's involved with this tremendously successful therapy that is available to many couples out there.